Hello, everyone. Welcome back to the Time to Heal podcast. Today, I want to talk about anxiety, its many faces and its many forms. So, what exactly is anxiety, and can a little bit of anxiety be a good thing? Well, anxiety is a normal reaction to stress. So you can get very mild levels, which are actually useful. So consider if you're writing an exam and you're preparing for this, having a normal level of anxiety regarding the examination would be useful because it gets you to study and it gets you to focus. On the other side, anxiety and stress can actually help you in times of danger. So if you find you in the wrong place at the wrong time and your stress and anxiety increases, you will find that a stress response can prevent you from danger. So there are more serious forms of anxiety, and this would require medication and therapy. More recently, I've been seeing an increased number of patients with long COVID. So these particular patients had COVID, they were in hospital, they suffered severe stress, they lost family members, but over time, they have not managed to fully recover from the longer term consequences of the COVID virus. And many of them have had different reactions to the COVID vaccine as well. So it's really difficult for them because they have a lot of anxiety, they have a lot of distress, and they are fatigued and tired a lot of the time. And we've seen a different type of anxiety response here. So in terms of understanding anxiety, anxiety is often about your concerns about the future, things you actually can't control. And there's a lot of anxiety in dealing with an uncertain, unpredictable future. You've probably heard on social media that people respond with, fight, flight, freeze, or fawn, to the different responses to anxiety. And I'm wondering what your particular response is. In general, anxiety causes avoidance. So if you're going to school, you wouldn't want to go to school. It also causes avoidance in terms of people going to work. People feel they cannot manage a proper full work day. And there's a lot of absenteeism that's due to anxiety and other mental health conditions. So there's a distinct link in the workplace between anxiety and work performance that needs more attention. The other thing that anxiety will do is cause you to avoid conflict in your close relationships. So things get proverbially placed under the carpet, but it does accumulate over time. So in terms of how serious things are, understand that fear and anxiety, when diagnosed, we often see that the fear and anxiety is out of proportion to what the person is actually dealing with. Also note that anxiety needs to be seen as age appropriate. So what a teenager and a young adult and an older person may view as anxiety differs. I have patients who are over 70 and even over 80 years old, and getting older comes with a lot of anxiety. Being forgetful may be part of a normal day, but when you're older, You start wondering whether you have dementia. Or, for example, if you slip and fall, you start wondering whether you are losing all your strength. Yes, there is a loss of strength as we get older, but it needs to be placed in context. And it's very important to understand the concerns of an aging population. The one thing for sure, anxiety affects your ability to function normally. So all the things that you would normally do in your day when you're anxious, you actually are unable to do most of it. There are different types of anxiety disorders that present to us in the mental health space. And I'm going to speak more about the two most commonly seen disorders. The first is what is called a generalized anxiety disorder. And second, we have a panic disorder. And I'll tell you more. But the other things that we see very commonly in our clinical practices are phobias, which is anxiety about a particular environment, person, or situation. We also have social anxiety, separation anxiety in young children, and we also see something called selective mutism, where a person is so anxious that they lose the ability to speak. So let me tell you about generalized anxiety disorder. And the first hallmark of this is excessive and ongoing worry. And this interferes with daily life. I think about my patient, Jack, who's now in his 40s, and he's had a lifetime of anxiety. And when he comes to sit in my waiting room, he's always restless. He's edgy. He will be fatigued a lot of the time. He can't concentrate. And he would always tell me about sleep difficulties. So these are all the physical symptoms of a generalized anxiety disorder. And Jack worries about everything. And this is the hallmark of anxiety. He would worry about his job. He works in the banking industry, and he's always afraid that he's going to lose his job, that he will be retrenched. He worries about his family, his health, and his biggest fear is not having enough money. Recently, his car broke down, and it was tremendously worrying for him until the car was repaired. Interestingly, with Jack, he would be anxious in making the appointment. He would sit in the waiting room feeling anxious. And when I came to call him for his session, he would have a startled response. That's how anxious Jack is. And for him, it's been lots of trauma from childhood, and that set the template for a life of anxiety. He is strictly medically managed and has therapy sessions at least on a monthly basis. Let's talk about panic disorders. Now, a panic disorder and being in panic, having a panic attack, is both physical and emotional, and it's extremely distressing. Most people, when they are having a panic attack, think that they're actually having a heart attack because it's such a visceral and physical experience. And you may have had it or know someone who does. So the first thing you would find in a panic attack is your heart starts racing, and that's called palpitations. You would also find numbing and tingling that can occur, and most people will start sweating, so profusely sweating. And there'll be chills and hot flushes that can also happen. With most of my patients, they start trembling or shaking, and that can be in the area of your lips or your hands or your entire body. And because it's such a visceral response, a lot of them report nausea and pain in the tummy area. And a panic attack will affect your breathing. So there'll be shortness of breath, there'll be a tight chest. And in the mind of the person, they will feel like they're losing control. And they'll feel lightheaded, dizzy, and think they're going to faint. A lot of them just want to open a window, go outside because they have a choking feeling and they feel like they can't breathe. So, as I mentioned, you think you're having a heart attack or you actually think that you are dying. Some people who have not treated the anxiety and the panic disorder can even have a panic attack happen while driving. And this tells you really at the point of absolute breakdown, emotionally and mentally. So if this is you, it is urgent that you get some help. The one thing that I tell my patients who really struggle with panic attacks, I would say to them, firstly, no one died from a panic attack. You may die from a heart attack, but no one has died from a panic attack, and you're not going to be the first person. Second, I will tell them a panic attack is a discrete episode. What do I mean by that? There's a beginning, it has a middle, and it has an end. So I help them put a time frame to it. So although when you're having a panic attack, it can feel like it's ongoing and lasting a long time. In general, with my patients, it actually lasts a few seconds. But being out of control is a terrible feeling. And finally, I will remind them that we have very good treatment for anxiety and panic disorders, that the medication available and the therapy brings a high rate of success. And this is important to remember. We also help them to identify the early signs of an ongoing panic attack. And for most people, they're dealing with something very stressful. Sleep is disturbed. The eating patterns are disturbed. And they do feel out of sorts in the days before a panic attack. So they have learned to monitor and to self-regulate. And this is the value of understanding that if you struggle with these things, that help is available. Thank you for watching, and I will see you next time.